My name is Yoanna McDowell, and I am currently a fellow here at VA Puget Sound in Seattle. I did my graduate training at University of Missouri, and today I will be giving a presentation on a project I've been working on looking at lifetime treatment patterns among folks with a substance use disorder. So briefly, just getting on the same page of what I mean by a substance use disorder. So a substance use disorder can be defined as a problematic pattern of substance use leading to a series of negative health consequences or problems in different areas, so work, home, and school. And roughly a third of Americans have had a substance use disorder at some point in their lifetime. However, only a small proportion of them have ever received substance use disorder care. So one national study from about 2012 to 2013 found that less than 30% of folks with a substance use disorder received any type of treatment. Um, and studies looking at this have primarily only looked at substance use disorder care. However, there's a high rate of comorbidity among those with substance use disorder. So they often have another mental health disorder on board. So it's important to also look at mental health treatment. However, few studies have done that. One study looking at that found that mental health treatment was more common than SUD treatment for folks who had co occurring disorders. And in that study, folks were twice as likely to receive mental health treatment over SUD treatment. And so that prompted our current study where we wanted to understand like across all people with substance use disorders, where are they receiving treatment? Is it in mental health or is it in substance use settings? And getting a sense of who these people are who go into these different types of treatment. And so, as I mentioned, current study goal is to explore lifetime treatment patterns among those with a substance use disorder. We wanted to better understand where people are receiving SUD care. Is it that, they're just receiving care for other mental health disorders and that suffices? Or is there really this need to provide more treatment for this population? And we're also interested in identifying factors related to treatment receipt, as well as potential barriers to substance use care. Um, I will only be presenting on a small piece of this, so we won't get into the barriers today, but I will be talking about some identity characteristics that are related to treatment receipt. And so the sample that I used was a nationally representative sample called the NESARC sample. This is a survey of the US population. We subsetted this on people who had a lifetime substance use disorder, which ended up being about a third of the sample, a little under 11,000 people. It was a mostly male sample, mostly white. And what we did is we conducted a latent class analysis on this subset of folks. And this latent class analysis grouped the about 11,000 folks into groups based on their treatment patterns. So we looked at lifetime substance use treatment, including AA to rehab, as well as lifetime mental health treatment receipt, from counseling to medications, et cetera. And then we let this program identify the groups, and then we characterize the groups using a two-step estimation process. So essentially what that involved was once we had these groups identified, we compared these groups on different characteristics to see how they are different. So we looked at some demographics, their psychiatric history, psychosocial history, their medical history, as well as barriers. For the purposes of today, I'm just going to focus mainly on one demographic, a little bit of the psychiatric history, and some psychosocial history. So these are the treatment groups that were derived from that latent class analysis. The blue bars represent different types of substance use treatment, and the yellow bars represent different types of mental health treatment. So our largest group here was the no treatment group. As you can see, like pretty much virtually no treatment among this group, some small instances of treatment, but generally no treatment in this group. So over 5,000 people without never receiving treatment for a substance use disorder. The second largest group were folks who primarily received treatment in outpatient settings for mental health. So this is primarily counseling or medication. And then we had a group here who kind of received all levels of mental health treatment. So the counseling, the medication, as well as inpatient utilization, emergency rooms, and self-help. And then we have this group here that we call our primarily substance use self-help rehab group. They also use some mental health, but generally these are folks who utilize AA, 12-step, or rehab treatment. And then our last group here really utilized treatment across all different treatment types. And so we called them our mental health and SUD group. And so these are just a select few characteristics that we looked at to try to see how these groups are different. One piece that stood out from the demographic examination is that the mental health, mostly mental health treatment groups, so that mental health outpatient and the mental health all group, primarily female compared to these other treatment groups. So there's a high proportion of women in these mental health settings versus a substance use setting. And when we looked at psychopathology or co-occurring disorders, broadly, we saw a picture where folks who are receiving mostly mental health treatment tend to have higher rates of these co-occurring disorders. Here's a couple examples with mood and anxiety disorder, where you can see the proportion is much larger for these groups compared to the other treatment groups. And when we look at measures of their substance use severity, so over here is a AUD severity and then DUD severity, it's just a symptom count. And what we see, unsurprisingly, is that folks who are receiving some form of substance use treatment tend to report more symptoms on average than those who are receiving no treatment or mostly mental health. And something that really stood out to us was just the high rates of substance-related legal problems among those who receive any SUD care, which really begs the question as how much legal problems related to substance use really gets people in the door for substance use treatment. Unfortunately, we're not able to disentangle that in this project, but I don't know, that really stood out to me is just seeing the high rates of substance related legal problems among this group. And so briefly, just going over some summaries and potential implications, what we see is that non-treatment seeker group, over half of the people who have had a substance use disorder never receive treatment for the most part. And there could be different reasons for this. Maybe they're earlier on in their substance use trajectory. So maybe at this point, whether it be problem recognition or lack of negative consequences, they maybe don't see a need for treatment. Or maybe the threshold for the need has not been met yet. And then of course, there could be people within this group who just have untreated chronic SUD, who have self-managed in their own way and for whatever reason have not sought out treatment. And then there's probably a substantial part of people who maybe naturally recover from substance use. So who have had a substance use disorder at one point in their life, never received treatment, but through however, resiliency or self-management tips have found a way to manage their substance use effectively. And so remaining questions are there potential unmet needs in this non-treatment group? Are they not seeking treatment because they don't need it? Or are there things that we can do to better address this group and better suit their needs? And then kind of tapping into some resiliency characteristics of some members in this group. What are the people who are naturally recovering from substance use doing? How can we maybe bring that into our treatment and prevention techniques? So are they using safe use strategies? Are they just figuring out how to use substances and have fewer consequences? Are they relying on social support, books, readings, things of that sort? And then, another question is, are there certain levels of substance use that don't require treatment? Maybe if you have a mild substance use disorder, it doesn't necessitate any treatment. And when we look at the other large pattern that we saw of like people primarily seeking out mental health treatment versus SUD, as with previous literature, people were twice as likely to seek out mental health only versus SUD. And we found out that group was more likely to be women and more likely to have higher rates of co-occurring disorders. Those within the SUD group tended to have higher SUD severity. And as I was relaying, like really tend to have these legal problems. So maybe this is the gateway into receiving SUD care. Some remaining questions here are the people in these mental health only groups receiving adequate care for their SUD? And also, why may women be less likely to engage in stud care? Is it that they're less likely to have substance use related legal problems, or maybe they're more likely to be diagnosed with a mental health disorder versus or another mental health disorder aside from substance use because of potential biases within our diagnosing? And also, a question that we've been pondering is like, are people accurately self sorting? Maybe people have a really good sense of what type of treatment that they need. And if they decide to seek out mental health treatment, maybe that's going to be the best fit for them. Maybe we don't actually have to provide them sud treatment and vice versa. And that's all I got. I just want to say thank you to my collaborators, and I can open it up for questions.
Okay, thank you so much.
Whoops.
And I have just a general comment, but I'm I'm curious that non-treatment group, just from like a family systems approach, how many folks, maybe are it's applicable that they're in these family groups where they are normalizing the drug or alcohol abuse, and everyone is saying it's not a problem, this isn't an issue, and trying to contain that issue as much as they can. So that was just a comment I wanted to make, but a very difficult thing to measure, I would think, overall. But again, just a comment on my end. Any
Yeah.
other, yeah, any questions, comments, anyone?
Yeah, Joanna, I'd love to hear you speculate. I like your hypothesis that, if there's some potential resilience and recovery here, there's times we don't need to over treat. It made me think of your category of folks who end up getting involved through the legal system, which whenever diversion happens, I think that's great, although we should do a lot more of it. But do you think there are times where maybe we are like over treating there, right?
Mm.
And those folks should be, kind of released back into the wilds of their life.
Yes, yes, yes. And this is primarily coming anecdotally. I'm not going to lie. My time being in the addiction treatment center, and the little bit I do know about people who can be legally referred is like sometimes people have made changes already around their substance use, and the legal system can be a little bit slower. By the time they get into Veterans Court or get recommended for treatment. And I know for Veterans Court here, treatment is typically 2 years, and I've experience working with veterans who like probably 6 months would be good, or maybe even a year. And so I do think that there is the risk of over treating folks who enter substance use treatment through the legal system.